Good morning, everybody. This is Paula Ropoleski with Leading Age Virginia. Thank you for being a part of the state of the P&C insurance marketplace for long-term care providers post-COVID-19. This session is being recorded and will be on our website after today. I want to introduce our speaker, Raphael Hachiski, who is a recovering attorney and current risk management consultant and insurance broker at Johnson, Kendall Johnson, JKJ. At JKJ, Raph works with executives in the long-term care industry by designing custom-made insurance programs that fit their organization's unique exposures at the most aggressive cost possible. Prior to joining JKJ, Raph was an attorney representing Fortune 500 companies in coverage disputes adverse to insurance companies. He obtained his law degree from Rutgers Law, where he received the American Jurisprudence Award for Trial Advocacy, and his Bachelor of Arts from Oberlin College in Ohio. He is still admitted to practice in all federal and state courts. Raph is a trusted and sought-after resource in the area of risk management and mitigation for senior housing organizations, having presented to various state leading age and other faith-based human service association chapters throughout the country. Raph is also a proud father to 3 intelligent and driven teenage girls and continues to pursue his left brain passion of piano and campfire guitar. So Raph, I turn it over to you.
Thanks, Paul. I appreciate it. And if everyone were able to see me, I have a lot more gray hair lately because of those teenage girls who are around a lot more. But thanks for having me, and I really do appreciate Leading Age Virginia and all the advocacy that you all are doing over there, Melissa and Paula and Sydney and Dana. You guys are all doing a great job. But more importantly, I know this is being recorded, so let me just extend our warmest gratitude to all of the healthcare providers out there who are on the front lines. You all are the true heroes, and we pray for each day as we're going through this. And we thank you for everything that you're doing. I am a former attorney, so I probably speak like I'm paid by the word, but I'll try to be as brief as possible. But it all makes sense in my life when I look backwards. And what I mean by that is that, like Paula said, prior to my role in insurance and risk management for long-term care, I was an attorney that was suing insurance carriers on multi-million-dollar claims on behalf of Fortune 500 companies. And then I got called over into the, I'd say, the right side, and where we now help nonprofits with their insurance and risk management. A little bit about JKJ, Johnson, Kendall, Johnson. We're based up in the Philadelphia area, but we have a national focus, and where we have about 120 employees, there's about 15 or so of folks in my role who are on the sales side. Everybody else is strictly service driven. And where you find that other brokers simply transact the insurance and make it sort of a commodity or a line item in the budget, we decided to take a much more aggressive approach from a industry sort of standpoint, in that we have departments who focus exclusively in construction, exclusively in technology, life sciences, manufacturing, distribution. And then our largest group is the Health and Human Services group, of which we do predominantly a lot of our work in senior living. Currently, we have around 225 long-term care communities across about 20 states, extending both into the not-for-profit and for-profit side. And we're also proud to be representatives of the National Council of Senior Living Brokers, which is an exclusive group of brokers around the country who are focusing on nothing but senior living risk. So I hope you all had your coffee this morning, just because we're going to be talking insurance for the next hour. So this is the brief agenda. So we're quickly just going to go over just a little insurance 101, just kind of re-educate you on how insurance works real quick. Then we're going to focus on what I think might be one of the most important pieces, which is the state of the market before COVID-19 happened. What we were seeing nationally was just a lot of issues with regards to carriers wrapping their heads around long-term care risk. And this was all before the coronavirus hit. So then we're going to kind of delve into how the coronavirus has affected the marketplace, what those new exposures are, how the coverage is going to respond, and then risk management strategies that we're deploying out for our clients that have worked over the last few weeks and look to be in place for many months to come, as far as it looks like so far from the forecasting models. So let's boil down your insurance premium dollar and just put on your insurance hat for a moment. If you're going to take of the premium dollar, the money you're paying to obtain protection from potential losses, and break it down, I'd say about 30 to 40% is going to be going into what we call fixed costs. And what does that cover? That's going to be covered in the administrative costs, such as turning on the lights, paying the rent for the carrier, the commissions that they have to pay us brokers for placing the business, operating expenses. That 30 to 40% of that insurance premium dollar that you're paying the insurance carrier is going right out the door and being used elsewhere. However, that's going to leave about 60 to 70% of what we call expected losses. And that's the amount that the insurance carrier is looking to hold on to and hoping that you as an organization are a little bit more risk aware and have mitigated the risk a lot better. And that means if you, the organization, have a better loss experience, the insurance carrier is going to win. But that's the big key. It's the if. That's the goal here. And our job is always to take you into what we call loss sensitive category. We want to make it so that our clients eventually have the ability to tap into the 60 to 70% of expected losses, and therefore they win if they have a good loss year. So prior to COVID-19, this is what the insurance industry was really dealing with from a national level. Obviously, we knew about hurricanes and storms and all that, and the Me Too movement was a big deal. Still is, I would think. California wildfires were prevailing, and all of this meant that we knew that there was going to be catastrophes out there that eventually was going to trickle down into the rate that we were paying for from our own insurance folks. So this is sort of the landscape that the folks were looking at, putting long-term care aside for a moment. And so what did they do, the insurance carriers do, to sort of mitigate the absorption of all this catastrophic risk that was out there? Well, they create the insuring agreement. And if you look at a policy, any sort of casualty or liability policy, you really should be looking at it as almost like an upside down triangle like we see here, where if you look at page 1 of your liability policy, it says, we will pay. We, the insurance carrier, will pay. Now, there's a lot of words in between page 1 and page 150, and I guarantee you by page 150, there's a lot less coverage that's there. And that's because of the fact that that insurance agreement that we will pay is then stricken away with conditions, limitations, things that you must do to get the claim paid. There's going to be exclusions, obviously. We will not pay for certain things. There you have low-hanging fruit stuff like criminal acts and asbestos and things of that nature. But all of a sudden, if you delve deeper into the policy, you realize that you might have exclusions for certain services, professional services that your organization is providing. And then after that, of course, we have endorsements in the policy that is going to change the base form language of that insuring agreement. And that's what we're left with, really, is that little triangle down the bottom, not just the big triangle that we think we have from a coverage standpoint. And so that's what insurance carriers do, just from a high level, to ensure that they can wiggle out of a claim down the road and say, you know what, we received this claim request from you, the organization. Look at page 97 for this exclusion or this endorsement taking away that coverage. We're not going to pay the claim because of this. And that's what they do to sort of mitigate their risk. So what was keeping carriers up in the long-term care arena? Before coronavirus hit, we knew abuse was a big issue. Senator Chuck Grassley was leading the charge, firing up, I believe, 2 different watchdog groups, one being the Inspector General of Health and Human Services, and the other one was the Government Accountability Office, doing some research and investigation into abuse claims in the nursing home setting. That was starting to make insurance carriers who were protecting those organizations with their insurance coverage a little bit more skittish with regards to the coverage that was being passed on. Couple that with the fact that we had increased regulatory scrutiny, that just did not make for a good storm for the not-for-profit long-term care arena, who was looking to ensure that they were getting coverage, but also ensuring that prices weren't going as high as they want them to be. Keeping carriers up prior to COVID-19 were these items here. And what we saw was that resident falls were making up almost 50% of all the total claims out there across the nation for long-term care. So what that meant for us was that of all the claims being submitted, half of them were related to fall risk. Obviously, our question next was, all right, well, then we're going to own that message as far as how we're attacking fall risk at our community and how we're going to work with our clients on deploying education that's going to teach our staff properly. And obviously, our staff know what they're doing, but maybe remind them, re-remind them, and provide them with the information on, what we can do to prevent fall risk. But you don't stop there. What we also were doing was pushing that ahead into the carrier's office and saying, hey, here's the documentation on our fall policy procedure, our approach, how we're doing our work to mitigate the risk that is falls. And you provide that to the carrier, and that makes them a lot more comfortable when they're doing their underwriting. Elsewhere, we saw pressure ulcers going up about 18.5%. We saw elopement proceedings were being a big issue. Those are the biggest average total payouts, over $300,000 per claim. And then there was errors in typical items such as medication administration, following physician orders, things of that nature. These were all the things that the underwriters were looking at from a risk mitigation standpoint prior to COVID-19. And so as a result, a lot of carriers made the decision to exit the marketplace. And what I mean by that is that their appetite, which is, in other words, the type of business that they're willing to write, just kind of went away for long-term care. And that left us with a few carriers, not as many as before, obviously, who were still interested and had the appetite to write long-term care risk. But that resulted in an uptick in submissions across the marketplace. And we saw underwriters start to get a little bit overwhelmed from a submission renewal standpoint. They also were seeing verdicts across the country going up significantly. All of a sudden, we saw plaintiffs' bar starting to focus a little bit more prevalent on long-term care, elder abuse. All of a sudden, where you were located became a damaging factor potentially on how you were being underwritten. Certain states were not getting as good consideration as others. The carriers were also getting a mandate to get more exclusions on the policy, restricting coverage, lifting up retentions, increasing deductibles, all without any control or input from the actual organization who was seeking the coverage. During the renewal process, we also saw an uptick in requests for the loss experience for our clients and our prospective clients when we were doing their renewals. Instead of being asked for the usual 5 to 7 years of loss runs, we were being asked for 8 to 10 years of loss experience. And all that was telling us was that the carriers were a little more skittish than before and trying to get their heads wrapped around what the risk was and what their experience was up until now. We also saw claims just go up extremely high over the last couple of years. And again, that was because of the fact that a lot more plaintiffs' attorneys were getting more specialized in elder care abuse, long-term care litigation, and things of that nature. And we saw the indemnity payouts go up as well significantly, almost 60%. And what I mean by that is instead of them, you have your medical damages portion, pay for medical and all that, but then you also have your pain and suffering damages. That's an indemnity payout. That went up pretty high, and we weren't liking that, and nor were the underwriters as well. And then all of a sudden, there really wasn't any differentiation anymore between not-for-profit and for-profit providers, where before we saw a lot of underwriters enjoy the fact that the not-for-profit was mission-driven, and they had a lot more goodwill capital that they could sell to that insurance carrier than the for-profit chain down the road. Now that differentiation is really not happening anymore because of the fact that the exposures are the same. And then finally, the publicly available information that's out there, as we know, is a big problem. Nursing Home Compare and Medicare.gov and all that, all those sites that provide information on the organization is information that's readily available to anybody who wants it. And that includes underwriters as well. And so during the renewal process, we started to find out that underwriters were doing their own due diligence and their own research before even coming to us and asking for information. So before COVID-19 hit, CNA issued I'd say a playbook of what they think the best risk mitigation strategies should be. What are they looking for from a renewal standpoint when they're underwriting the exposure for renewal? And so these are the things that they laid out to us. First off, they wanted to figure out what the service model was. Was that delineated for the organization? And how did that organization manage family expectations? How do they communicate with the family? again, we knew that fall risk was the big problem. And so as part of our renewal submissions, we immediately took the wheel and said, instead of being asked about what we're doing for fall risk, we're just going to tell them right out of the gate. And so we provide them with our policies, our procedures, our documentation on how we're educating our staff when it came to the fall-related claims. CNA was also indicating that they were looking for some more resident family trust that was fostered between the organization and the adult children. There were a lot of questions coming down the pike with regards to this increased scrutiny that was being applied into the long-term care setting. And so what are you as an organization doing to foster that family trust? Because we knew if you took control of that early on, the chances of getting into litigation with that family down the road was a lot less. Staff turnover obviously was a big issue before. It still is a big issue now. But all of a sudden, we found that carriers were starting to ask about hiring practices. A lot of our clients became best placed to work organizations. And we were providing that information to the carriers so that they would be able to paper the file and potentially offer outside the box coverage, outside the box pricing considerations. But again, what are you doing to address staff turnover, and what are you doing to retain your staff? What's your training regimen look like? You know, a lot of organizations we find have sort of a spotlight focus in that they'll just focus on that 10% rock star group that's doing really well. And the problem you have there is that you have potential to burn them out. You know, your A players are great, but those B players are equally as great, and they're going to fill the roles that those A players don't otherwise do. And so our goal was to remind our folks that don't burn out the rock stars that you have on your staff, and make sure that you're tapping into all your folks and training the leaders to get up and running properly and keep this wheel turning in the right direction. And again, at this point, we're dealing with multi-generations, baby boomers, Gen X's, millennials. And all of a sudden, we found that millennials and the Gen Xers were starting to request more information from corporate as far as what the mission was, what the strategy was for the organization. And then all of a sudden, the insurance markets were starting to ask that as well. And so we were providing that information to the carriers and saying, here's what we're doing from the front line, and here's how we're communicating with corporate. So looking ahead, again, before COVID-19, we knew that there was going to be what we call involuntary self-insurance. Retentions were going to go up, deductibles were going to go up, coverage was going to be taken away. And again, it's not like the insurance carrier is going to come out and say, here's your renewal. Oh, and by the way, you don't have this and that coverage that you had last year because we put an endorsement on that removes that coverage. So we saw exclusions starting to pop up more, and during our negotiations, we had to fight back a little bit more. We expected double-digit increases in the claim costs to trickle down in rate to our clients. And again, the appetite for those carriers that were leaving the market started to affect those that had stayed in there. So in summary, pre-COVID-19, hardening market, less carriers, price go up, coverage being taken away, and all of a sudden we found the carriers are going to be a lot more selective on even those accounts that they were even going to provide a quote on. And so what we were doing, as I mentioned in the last couple slides, is documenting the file properly, walking with that underwriter down the renewal path and providing them with the information that's needed to answer the questions they had from an exposure standpoint. And then this happened. And, you know, Charlie Chaplin has a nice quote. He says, "Life is a tragedy when seen close up, but a comedy in the long run." And I'm by no means saying that this is a comedy, but at the same time, I know that we need to find silver linings in all of this. Saw this recently. My kids loved it. If 2020 was a slide, and I know many feel like this right now out there, but the reality is this is what we know our people are dealing with. I heard a really interesting quote from Jill Schumann recently on a Leading Age Maryland call, in that these folks on the front lines have learned to smile with their eyes. And again, we know what you're going through, and we're prayers with you. From an insurance standpoint, these are the tears that were being shed for insurance carriers. And remember, insurance carriers are beholden to shareholders. They're not beholden to the organizations they're covering. They're not beholden to us brokers. They have shareholders who they like to pay out profits to. And this, as of February 19th, 2020, is the index return or lack thereof from an insurance carrier standpoint. And if you added all these numbers up, it looked like about a 32% average loss across the board. So immediately we knew that with COVID-19 hitting, with a hardening market you had before, plus COVID-19, it was just going to be a recipe for a much more catastrophic 2020 from an insurance renewal standpoint. However, these are maps from LA, Chicago, and Manhattan, and if you can take a look at them, you'll see on the left of the images are sort of a typical 4 o'clock rush hour, and then on the right we see all the green routes as it is of April 1st, 2020, because everyone's starting to stay at home. So what this tells us is that maybe the silver lining is that claims across the board are going to go down a little bit from an auto liability standpoint. Conventional wisdom suggests that work comp will probably experience a brief dip in claims activity. However, one can imagine that with recessionary conditions and incentives for employees to shift healthcare costs to their employees, maybe it's going to go up. But all in all, we heard that the carriers are going to be okay financially. And then we saw articles start to pop up across the country related to business income loss. And all of a sudden we found states potentially introducing legislation that would say, regardless of the coverage that our people have, we need the carriers to step up and provide business interruption claim loss dollars for the folks who are out there losing income on a daily basis. The carriers did not like this. They obviously fought tooth and nail to make sure that they didn't have to pay claims that were otherwise excluded on policies. The problem you had was that we saw lobbying groups, restaurants, for example, making up a very, very large chunk of the sort of general industry from a commercial standpoint, pulling together to fight back against those carriers and say, listen, regardless of our insurance, we need insurance carriers to pay out our claims. And that was not really met well by the insurance carriers. And this was the quote that was issued by one of the representatives of a national mutual insurer association, retroactively requiring contractual changes for which no premium was collected is a dangerous, unprecedented, and unconstitutional proposal that we emphatically oppose. So let's play out how the claims would be paid out from a sort of coverage by coverage standpoint. And I'll go high level here, and then we'll get into how the long-term care setting has been affected. So once COVID-19 took front and center, we started fielding a variety of calls from clients regarding applicability of coverage. And this is where you stay ahead of the game by pressure testing your insurance coverage, essentially reverse engineering a claim or a loss to see how your specific insurance program will respond to any loss. Now, we're obviously focusing on the coronavirus-related loss. But this is what everyone should be doing now as opposed to when you actually have to submit the claim. So from a GL or PL standpoint, a claim brought by a third party for bodily injury or property damage resulting from an alleged unintentional or negligent failure to protect from the virus would fall under the basic coverage grant of a general liability policy, one would think, as well as the umbrella and excess policies. However, insurers obviously are going to stand up and assert a variety of potential coverage defenses, such as pollution exclusions. Insurers might contend that bacteria and viruses constitute pollutants, and so certain policies define pollutants to include viruses, while others specifically provide that viruses do not constitute pollutants. And then some are silent on the issue. So how does that play in your policy? Others have what's called a fungi or bacteria exclusion. And while COVID-19, much to the chagrin of our president, is not a bacteria, nor is it intelligent or have a brain, illness may occur due to secondary infections brought on by the virus. And so carriers might rely on that fungi bacteria exclusion. There might be an intentional acts exclusion on your policy. So depending on the circumstances, a carrier might contend that coverage is excluded because the insured acted, quote, intentionally by having folks come onto their community or proceeding in the face of a known risk. Is that an intentional act? And then finally, the communicable disease exclusion. We've seen a lot of policies have that as well as we're going through our review. I mentioned this earlier, but as from a workers' compensation standpoint, as the pandemic continues, companies should be aware of potential claims filed by employees, and while statutes can vary by state, the compensability generally requires that an illness or disease is occupational in nature, obviously. It means that does it arise out of the course and scope of employment, which is normally determined by whether an employee was benefiting the employer when exposed. Is it proven to be a result of workplace exposure? Is it peculiar to the employee's work, meaning the disease is found exclusively there, or is it a greater risk for other employees? As the coronavirus continues to spread, it's going to become increasingly more difficult to determine whether an employee has contracted the illness in the workplace or elsewhere. Obviously, healthcare workers and first responders of those natures are going to be more on the hook to be infected by patients, coworkers. But what about family members, neighbors, strangers, folks you run into in the grocery store? Really, the argument of compensability is going to be up on the front center for an extended period of time here as we go through how the law is going to react to COVID-19. In the end, if an employee contracts COVID-19 through work, we obviously are going to go through the steps of reporting the claim immediately to the TPA or the insurance carrier, and then have legal or claims experts carry out the investigation and do that contact tracing to find out where it potentially came from. And obviously, we're going to be doing that testing of the employee. More broadly, claims directly tied to COVID-19, we're telling organizations to be prepared for an increase in claims frequency. Generally, we're seeing a lot more telecommuting injuries occur for some reason or another. That's going to start to trickle down into the market as well. All in all, employers should be broadly prepared for a longer claims process, higher overall claims costs as the pandemic continues. Mediations, hearings are going to be postponed. IMEs are going to be postponed. Many recovering employees are going to have no transitional job to return to, and that's going to keep them out a little longer. So we're all sort of keeping an eye on how this is going to progress as we move forward from a work comp standpoint. Focusing on the property, which property coverage is what we call your stuff, your first party coverage. So this is the protection for your equipment, your buildings, your all of your stuff. And obviously, COVID-19 pandemic has prompted many cities and states to just shut down or restrict public activities, closing malls, schools, entertainment venues. So while demand has increased for businesses to stay open, others have felt the effects of that pronounced reduction in economic activity, and so they're looking to their property policy to see if they can get that business income coverage that I mentioned earlier. This quote here is typically what is found on your property coverage. We will pay for the actual loss of business income you sustain during your necessary suspensions of operations during the quote period of restoration, but the suspension must be caused by direct physical loss. So what does that mean exactly? So traditional property policies are generally triggered by that direct physical loss or damage. And while many have a coverage for business interruption loss, other time element coverages such as civil authority, ingress, egress, leader property, contingent business interruption, all of those arguments might manifest as we're seeking coverage. In the end, there is no single version of a property policy that's going to provide coverage or not. And while it looks like on its face that there could be potential for coverage, keep in mind that there's going to be a variety of hoops that must be jumped through, as well as exclusions which have to be sort of made aware of before we submit the claim or consider submitting the claim. From a directors and officers or employment practices liability standpoint, we know that there's already been 2 securities class action filings outside of long-term care that have been filed that are definitely going to be D&O issues with regards to mismanagement of the organization, alleged deficient disclosures, failure to act. The problem we're seeing is that D&O and EPL policies typically include certain limitations on coverage for illness and bodily injury. D&O policies are not made to cover bodily injury, so they might be narrowly tailored. So depending on that specific policy language, coverage might not even be enacted within the policies that were already in place. So what we're advising our clients to do is really work with us as we go through the policy and review the language in the policy from the insurance carrier standpoint to ensure that either the claim should be submitted or not. Either way, during the renewal discussions, you have to be prepared to discuss with the D&O underwriters as well about how you are controlling the pandemic within your organization. What are you doing to mitigate the risk? Companies renewing their D&O policy right now have to be aware of the retentions, especially in this area, going up. We've seen a lot of carriers just blanket across the board say that the deductibles where before are 10, 15, 25, 50,000 are now going above the 100,000 line. From an environmental or pollution legal liability standpoint, this is still considered a discretionary purchase by many, but PLL policies can vary significantly by insurer, but we've really placed a bunch of healthcare specific PLL policies for our clients. And again, this is going to be covering pollutant related risks at the organization level. And when I say healthcare driven, they are sort of tailored into covering MRSA and SARS and potentially COVID-19 as well. The issue that we need to sort of walk through as we're going through the policy is, what's the definition of a disinfection event? What are the definition for decontamination costs? Is there a sublimit for the communicable disease coverage? Is coverage tied to a facility-borne illness? Does it have to arise out of the organization? Is the carrier going to say it didn't come from your campus, and so we're not going to provide the coverage? Given the variability in terms and conditions of various pollution liability policies, coverage is going to differ greatly. So what we're advising our clients and prospective clients to do is to really work with the carrier, provide them with the information on specifically what services are being provided, and ensure that the policy that's being purchased is matching up with the operations that you're performing. So right after COVID-19 hit us, we reached out to our senior living insurance markets just to get a pulse as far as what it was that they were thinking about as a sort of go forward standpoint. And this was their reactions. Not writing business until May. That obviously is probably going to change now because of what we've seen and how things have gotten extended a little bit further. No new business for the time being. We'll write new business, but you have to sign this COVID-19 supplemental application now. And then, like I've mentioned before, many have just said we're not interested in senior living anymore. So while overall capacity in the healthcare market may not appear to be an issue now, we're still monitoring that pretty closely to make sure that we have enough options out there from a carrier standpoint to ensure that we sort of have a competitive industry where we can have one carrier going up against another at renewal. So in speaking with a lot of these carriers, these are the items that we're seeing from an emerging exposure standpoint as the healthcare landscape now quickly evolves. And I'll jump right into this. So reduction in staff. Typical exposures are routinely seen in hospitals and nursing homes with staff reduction. We've seen a lot of folks have staff either just choose not to come to work or not be able to return to work. This obviously impacts negatively the quality of care and can lead to more resident injuries at the organization level. So what we anticipate is this exposure is definitely going to lead to more claims regarding negligence and medical malpractice. To combat shortages in staffing, some states have asked former practicing physicians, nurses, etc., to rejoin. Carriers are allowing that on sort of a case-by-case basis, and they're not viewing that as sort of a temporary practice in response to COVID-19, but it still would make sense to let folks know and let carriers know what you're doing from a staffing standpoint and how you're staying ahead of your staff sort of dwindling. Volunteers, while right now might not be a big issue because of sort of stay-at-home and no visitation policies, we know many organizations have a strong volunteer base. So volunteers will have to have coverage if they're already on the policy. You're going to look at the definition of insured to ensure that volunteers are part of that. But we want to make sure that the carriers are aware of the fact that the volunteers are not getting on the campus as of right now because of our no visitation policies. We know temporary hospital spaces is an issue. There we go. Oh, there we go. And obviously, to keep up with anticipated patient demand, temporary hospital spaces are being erected across the country, but we also know that hospitals are now sending patients to long-term care providers. That's going to be an issue as well. And the question has become, do we let the carrier know? And what we're advising is instead of just kind of shuttling under the rug and hoping the carrier doesn't find out about something, we have to have an open dialogue and letting folks know, especially the insurance carriers who are protecting the organization from a financial standpoint, what's going on. Telemedicine has now become front and center, obviously, and with the lifting of certain restrictions required for Medicare reimbursement, it's now going to be used a lot more. And similar to temporary hospital spaces, coverage generally remains in place as long as the services are conducted in the state in which the doctor is authorized to license to practice. And then finally, we know that the sort of non-urgent procedures have been delayed at the recommendation of the CDC. We know that now with those services going down, it's going to allow our folks to focus a little bit more on the pandemic that's at issue. In the end, when we're talking to carriers, we're ensuring them that we're doing all the things from the organization level to stay ahead, but we're also coming to them and asking for consideration, be it for refinancing of premiums, spreading out premium payments, policy extensions, things of that nature. We're advising that we sort of work on a case-by-case basis, and that's what all you guys should be doing as well, is work with your broker to have the dialogue with the carrier, provide them with the information as far as what's going on, and put them at ease so that you can work collaboratively going forward. So now what we have to do is we have to sort of add COVID-19 to how the insurance carriers are responding, and we expect the market pricing to go up even more significantly over the next, let's say, 18 to 24 months. Again, that there's going to be a lot more exclusionary language related to coronavirus that is going to start to get popped up on renewal quotes. And I mentioned before, but supplementary applications are going to become more of the norm. And what do I mean by that? So Chubb came out with what we call an absolute exclusion when it came to coronavirus. They said, we'll provide you a renewal quote, but this endorsement is going to be attached to the quote. No questions asked. Take it or leave it. This is not a negotiating tool, not a negotiating point. And if you look right there in the red circle, this insurance does not apply to coronavirus disease. Chubb is saying we are not going to cover this risk. Elsewhere, Ironshore provided an application for COVID-19. And this is sort of questions that they wanted answered as far as, what are you doing from a policy procedure standpoint to stay ahead of the coronavirus? And while supplemental applications typically can be viewed as sort of the bane of CFO and other folks' existence who are handling the insurance at the organization level, we use this as sort of not a best practice, but maybe as a checklist for what is it that we're doing out on the field to mitigate the risk? Are we limiting and screening visitors to reduce infection sources? What's our protocols in place? And there we go. And what PPE are we using? And if we don't have it, why don't we have it? And what have we done to try to get it? CNA, obviously the 800-pound gorilla in the room that does a lot of long-term care coverage, just like any other brokers or any other carriers, came out with a document that said, this is how we're going to respond to coronavirus. And I'll save you the time reading it. All you have to do is read this last paragraph, because that is sort of par for the course. Refer to your specific policy terms and conditions regarding potential coverage. And what do we mean by that? In that same document, CNA issued a couple of questions, essentially, how will my coverage respond? So the first question you see up top there, healthcare facilities are treating COVID-19 patients and responding to the pandemic. Will I be covered for patient claims? Well, I'll save you the chance for reading. All you need to read is, however, coverage for each claim is dependent upon the terms and conditions. What if I need to take residents out of the community in a sort of emergency evacuation situation? And again, coverage for each claim is dependent on the terms and conditions. So in the end, the motto here, the goal here is to say, you be well set off in proactively managing the coronavirus exposure by self-evaluating the adequacy of your coverage today with your existing insurance program before the potential onset of losses, which we know is going to happen. And you want to stay ahead and make sure that that little triangle there is the coverage that you need at your organization level. Elsewhere, we're seeing now all of a sudden various states start to issue immunity. And again, it's not blanket immunity, but immunity for COVID-19 related lawsuits. As of today, I believe it's New York, New Jersey, Connecticut, Illinois, Iowa, Michigan. A lot of these states now are stepping up and saying we're going to provide immunity for the organizations and for any lawsuits that arise out of the care related to COVID-19. The one sort of takeaway that we're advising our clients right now with regards to this is to not take it as a blanket immunity. Instead, realize that the immunity is going to extend to the actual caregiver, but at the same time, claims related to management of the organization, corporate negligence, things of those nature that will go into more of a D&O exposure, those do not fall under the bucket of this immunity that's being provided by various states. So we're advising our clients just to stay ahead of that and ensure that they know that this immunity does not mean blanket immunity. So the strategies that we're deploying right now, just to stay ahead of the pandemic, is we're obviously following the CDC guidelines. I mean, everyone's checking that on a twice daily basis at the very least. But to limit the spread of the virus and ensure a quick response and containment, we're telling folks to document everything in great detail regarding how the CDC guidelines are being followed, what steps are being taken to protect patients and their residents from stopping the infection. If the infection does occur at the facility, do you have detailed documentation on how you're protecting everyone else? How are you taking care of this resident? Put yourself in the best position to defend against potential litigation. Also remember to document to the negative that you've had no reports of any contact with the virus or those who have it. Logging data continually will do nothing better but support your position, whether or not you need to submit a claim down the road. Any institution with a higher than average mortality rate knows that they have to think of a defense at this point. So facilities who are now starting to experience the pandemic from a fatality standpoint need to think about how they're going to best defend from a lawsuit standpoint down the road, and securing the communications and documenting the events now will make sure that you have a fair defense down the road. We also want to have a dedicated task force that's going to convene daily and provide information to the staff on what the corporation's doing, what the organization's doing facility-wide, and if there are any questions or answers that need to be provided for staff. We want to make sure that the resource is being exchanged amongst the employees so that they know what's going on. And again, communicating regularly with staff, residents, and their family members so that they feel included and they're made aware of everything the facility is doing to mitigate the risk. And as the pandemic continues, the psychological effect obviously is going to deepen. And the fears and anxieties can compound with misinformation that's driven by social media, the news outlets. And we know that a lack of factual information from employers can add to staff and resident worries. So these folks, the employees, are the most important for our organization. They're eager for details about the organization's response to the ongoing pandemic. They want to be able to pass that information on to their residents. They should be advised to avoid any speculation or reliance upon faulty resources, and they can limit their exposure by turning off notifications on their cell phones and devices. Tell them to avoid the live television broadcast. Stop watching the president's their daily White House press conference. Provide mindfulness or meditation exercises, apps, whatever, websites, recordings, thoughts, journals, notebooks, diet regimens, whatever it is to provide that staff with information that isn't going to drown them in the coronavirus. We want you to assign designated personnel to monitor information from the CDC and WHO on a daily basis. And again, provide that information with the folks on your front lines. From a policy standpoint, we also want to make sure that you're not only implementing the policies, but really following through with them. And the reason I say that is because your policies are going to be tested right now, most importantly. And I bring that up because we have one client up in Basking Ridge, New Jersey, Fellowship Senior Living. And their policy was that you are not allowed on the campus unless you have been tested, period. The United States Postal Service took issue with that and said, we are waived from having to do that. We're not going to do it. And Fellowship Senior Living said this, well, then you're not going to come on our site. And after a few weeks of push and pull, there was finally a process that was set up by Fellowship to ensure that the folks received their mail Obviously, it was delayed a little bit as things had to be disinfected, but they created the process to ensure that the mail got to the residents. But really, the long and short of it is that they stuck to that policy and ensured that that mail person didn't get on the campus, because we wanted to make sure that we closed as many holes as possible going forward to ensure that coronavirus didn't make it any further in our community. Continuing on the risk management strategies, we want to make sure that you have a crisis contingency list that you have in place and you're really sort of ready to run with it. What we mean by that is, from a workforce standpoint, many of our clients, and I'm sure you have as well, have executives who are now working on the floor. We have COOs making beds and providing DON duties because certain CNAs aren't available. Are we ensuring that we have our supplies in place? Are we ensuring that our relationships have been pressure tested right now? And when I say relationships, I mean obviously with the hospitals that are close to you, the vendors, the business partners, folks like us that we're working with our clients, but also your competition. Now is not the time to get overly competitive. Instead, we want to band together, leverage each other's goodwill efforts, and make sure that we're all going to survive this pandemic. And then, sorely on a not unrelated note, but cyber hygiene. While a far greater number of employees are working remotely during COVID-19, cyber criminal activity is ramping up, and we see a lot more activity as far as infiltrating business IT infrastructures. So keep that in mind and remind your employees that now is not the time to let down the guard from a cyber hygiene standpoint. For the leaders out there, everyone's watching you. And here are the few tips that we're advising our executives as everybody keeps eyes on you is project calmness. Emotions are contagious. And if you as a leader look, act, or talk in a panicked fashion, everyone else is going to pick up on that. I'm sure you've gathered it by now, but over communicate. You have 1,000 balls in the air. There's bound to be details missed, things that fall through the cracks. Over communication is going to ensure that that happens less and less. Ask softball questions to other folks. What does help look like right now? What do you need from me? If you could wave a magic wand, what would come off your plate to provide relief? Ask those questions of your staff and of your residents and be there for them as you continually over communicate. A lot of you have boards that you work with, and board members are yearning as many work from home, myself included. I'm on the board of a long-term care organization up in New Jersey, and what we're doing is providing service and resource to the community from our networking standpoint. We can make phone calls as well. We can advocate for the organization as well. So seek that board assistance. Now is not the time to reprimand staff. Encourage your folks. Don't reprimand. It's not time to point fingers at one another. And remember, everyone is watching, and be grateful. Count your blessings and encourage others and give thanks. So looking ahead, this is what we have to look forward to. Continued disruption across the continuum. And what do I mean by that? We're going to see, obviously, a lot more influx of hospital patients being pushed into the nursing home setting just because of volume issues. We're going to see what we like to call acuity creep, where, say, for example, that assisted living resident now is maybe creeping into a skilled setting, or the IL residents maybe needing a little bit more services that now makes them more of an AL resident. And again, push your network for advocacy. Keep getting information out to your representatives to ensure that all of our organizations are getting proper funding. Your frontline staff are your greatest assets at this point. Protect them. They are just a vital asset. Provide them with scheduling options to mitigate the burden. Maybe even provide sort of flexible shift scheduling. Is your fleet lying dormant in the parking lot right now? And if so, why aren't you providing shuttles for your staff for transportation home potentially if they need it? Are we having sort of our staff who are not doing the clinical aspects, but can they do sort of non-clinical tasks such as making beds, folding laundry? Anything now to alleviate the burden will be helpful. And again, follow those CDC guidelines to ensure we're doing everything correctly. Looking ahead from an insurance standpoint, it's sort of an A plus B equals C. You're going to have your pre-COVID, your 50% of all claims are fall risk, your abuse issues, your 5-star scrutiny, all of that stuff from before coronavirus now added to COVID-19. That equals what our current landscape is right now. Just remember, before it was hard. Now it's even more hard. The market has just gotten that much worse with market confusion and volatility. So be aware as you go through your renewal for what we like to call involuntary self-insurance. Don't just accept what the carrier is representing to you with regards to coverage. Ensure that you're working with your broker to walk through the policy, that quoted policy, to ensure that the coverage you're getting is keeping up with your operations. And most importantly, information is key. It's all the stuff that you can provide that underwriter during the renewal to improve your story that's being told in the marketplace will do nothing but help you out. Oh, and by the way, I forgot to mention, we have hurricane season happening. And Colorado State University just issued their forecast for this year, and now they're saying there's going to be an uptick in storm activity. Wonderful. Just keep that in mind as we look forward down the road. And if anything, this is the graphic. Fall risk plus COVID-19 equals question mark. But we are here to help, be it through a confidential policy coverage analysis, having our safety guys come out and do a mystery shopper community-wide audit, a workers' compensation loss analysis, or simply just a review of your contracts to see which way the risk is flowing for your organization. All of that stuff we can do for you, and we're happy to help. And again, thank you to all of the folks who are standing on the front line, protecting those who are the most vulnerable, providing services without asking questions, and being there and serving as such great ambassadors for all of us in the healthcare industry. Thank you for those who joined today and for those who are listening on the recording. And again, thank you to all the Leading Age Virginia folks for allowing us the opportunity to present today.
Thank you so much, Raph. Does anybody have any questions before we end it up? You're more than welcome just to unmute yourself and ask. Nope. Okay. Well, thank you again for being on this recording webinar, and thank you again, Raph, for this most timely and very important information.